Welcome everyone, Dylan Gemelli here today with a brand new video for you. So today I'm going to give you an overview of intermittent fasting, also called IF. Now, intermittent fasting is an eating pattern that cycles between periods of fasting and eating. Now, it doesn't specify which foods that you should eat, but rather when you should eat them. In this respect, it's not a diet in the conventional sense, but it's kind of more accurately described as an eating pattern. Now, common intermittent fasting schedules, and methods involve daily 16-hour fasts or even fasting for 24 hours twice per week. Now, fasting has been a practice that's been done throughout human evolution. Ancient hunter-gatherers didn't have supermarkets, okay? They didn't have refrigerators and food sitting there year-round. Sometimes they just couldn't find anything to eat, so as a result, humans evolved to be able to function without food for extended periods of time. In fact, fasting from time to time is more natural than always eating 3 to 4 or more meals per day. And fasting is also done for religious or spiritual reasons. It's included in Islam, Christianity, Judaism, Buddhism. Now let's talk about some methods, because there are different methods to this. There's not just one. They all involve splitting the day or week into eating and fasting periods. So, during the fasting period, you eat either very little or you don't eat anything at all. So, these are the most popular methods. The first one is the 16-8 method. It's also called the Lean Gains Protocol, and it involves skipping breakfast and restricting your daily eating period to 8 hours, such as 1 to 9 p.m. Then you fast for 16 hours in between. And then there's also the Eat, Stop, Eat method. This involves fasting for 24 hours once or twice a week, for example, by not eating from dinner one day until dinner the next day. Now, then there's also the 5-2 diet. So what's this? With this method, you only consume about 500 to 600 calories on 2 non-consecutive days of the week, but eat normally the other 5 days. Now, by reducing your calorie intake, all these methods should cause weight loss as long as you don't compensate by eating much more during the eating periods. Many people actually find the 16-8 method to be the simplest, most sustainable, and the easiest one to stick with, and it's also the most popular. Now, how does intermittent fasting affect your cells and your hormones? When you fast, several things happen to your body on a cellular and molecular level as well. So, for example, your body adjusts hormone levels to make stored body fat more accessible. Now, your cells also initiate important repair processes and change the expression of genes. So here are some changes that occur to your body when you fast. Number one, human growth hormone. The levels of human growth hormone skyrocket, increasing as much as 5-fold. Now why? This has benefits for fat loss and muscle gain, to name a few. Insulin sensitivity improves and levels of insulin drop dramatically. Lower insulin levels make stored body fat more accessible. Then, cellular repair. When fasted, what happens? Your cells initiate the cellular repair processes. This includes autophagy, where cells digest and remove old and dysfunctional proteins that build up inside cells. Then we've got gene expression. There are changes in the function of genes related to longevity and protection against disease. So these changes in hormonal levels, cell function, and gene expression are responsible for the health benefits of intermittent weight fasting. Now, it's also a really powerful weight loss tool. Weight loss is the most common reason people even try it. The most common reason. By making you eat fewer meals, intermittent fasting can then lead to an automatic reduction in calorie intake. Now, additionally, intermittent fasting changes hormone levels to facilitate weight loss as well. Now, in addition to lowering insulin and increasing growth hormone levels, it increases the release of the fat-burning hormone norepinephrine. So, because of these changes in hormones, short-term fasting may increase your metabolic rate by, anywhere from 3.5 to 15%. Now, helping you eat fewer and burn more calories, intermittent fasting causes weight loss by changing both sides of the calorie equation. There's also been studies out there that show it's very powerful for weight loss. There was a study done back in 2014, and they found that the intermittent fasting eating pattern can cause 3 to 8% weight loss over 3 to 24 weeks, which is a significant amount compared to most weight loss studies. Now, the same study also indicated that people also lost 4 to 7% of their waist circumference, and that also indicates significant loss of harmful belly fat. There was another study that showed intermittent fasting caused less muscle loss than the more standard method of continuous calorie restriction as well. And there's health benefits here too. Weight loss, as I've already talked about, insulin resistance. Now, intermittent fasting can reduce insulin resistance, which lowers blood sugar by 3 to 6%, and fasting insulin levels by 20 to 30%, which should protect against type 2 diabetes. Inflammation. Some studies do show that reductions in markers of inflammation, which is a key driver of many chronic diseases, is present with intermittent fasting. And then heart health. It can actually reduce your bad cholesterol, blood triglycerides, inflammatory markers, blood sugar, and insulin resistance, all factors for heart disease. Now, animal studies suggest that intermittent fasting could help to prevent cancer. Intermittent fasting also does increase the brain hormone BDNF and may aid the growth of new nerve cells, and it can also protect against Alzheimer's and anti-aging. Intermittent fasting can extend lifespan in rats. Studies showed that fasted rats live 35 to 85% longer. Now, many of these studies were small, short-term, or conducted in animals, so there are more questions out there, but these are all studies that have shown the benefits. Now, intermittent fasting can also make your healthy lifestyle simpler. So, eating healthy is simple, but it can be hard to maintain. One of the main obstacles is all the work that's required to plan and cook healthy meals. Intermittent fasting can make things easier because you don't need to plan as much, you don't need to clean up as much, and you don't need to cook as much. Who should be careful or avoid intermittent fasting, though? It's not for everyone, all right? If you're underweight or have a history of eating disorders, you should not fast without consulting with a health professional first, all right? So in that case, it could be harmful. Now, how about some safety and side effects? Hunger is the main side effect, okay? You might also feel weak, and your brain may not perform as well as you're used to, especially initially. It's just temporary. Your body has to adapt to this, whole new style. If you have a medical condition, you should also talk to your doctor. So if you have diabetes, if you have problems with blood sugar and regulation, if you have low blood pressure, if you're underweight, if you take medications, if you have a history of eating disorders, if you're a woman trying to conceive, if you're a woman with that's pregnant or breastfeeding. So those are all things that you need to be aware of as well, okay? Now, one more thing I want to talk about real quickly. There is some evidence that intermittent fasting may not be as beneficial for women as it is for men. One study showed that it improved insulin sensitivity in men, but worsened blood sugar control in women. Now, human studies are unavailable on this topic, okay? Studies in rats found that intermittent fasting can, make female rats masculinized and fertile and cause them to miss cycles. There are a number of anecdotal reports of women whose menstrual periods stopped when they started doing intermittent fasting and went back to normal when they resumed it. So for this reason, just be careful if you're a woman, okay? If you have issues with fertility and you're trying to conceive, you might want to consider holding off for now. But I wanted to make sure I talked about this briefly because I don't see too many people ever talk about this, but these are facts out there that I found when I was looking, for more information on besides what I already had. So just wanted to cover everything I possibly could on intermittent fasting. So that being said, www.icearms.com/forums. I'm also on the Evolutionary Forum as well as the Elite Fitness Forum. Dylan@icearms.com is my email. You can get me with all questions and comments, and please don't forget to subscribe to the channel. That being said, stay tuned for plenty more to come. Dylan Gemelli, signing off.